A new report from the Canadian Centre on Substance Use and Addiction says labels on booze containers are needed to warn consumers about the serious risks linked to alcohol consumption. The new guidance is based on the findings of 23 experts. They analyzed close to 6,000 peer-reviewed studies during a 2-year process that also considered public feedback. Now, according to the most recent available data, alcohol is associated with a number of cancers, including breast, colon, mouth, throat, and liver. Well, joining us now to talk more about this issue is Dr. Tim Naim, director of the Canadian Institute for Substance Use Research and a member of the advisory group that designed the new guidelines. Dr. Naim, welcome to Forum Daily.
Oh, thanks for having me.
Now, we all know that drinking can be bad for you, but what sort of new information has this report revealed when it comes to drinking alcohol?
Well, I think basically what a lot of the science has been showing over the past 10 to 15 years is that the risks start to go up at levels that are quite a bit lower than have been appreciated before. So they start to go up as little as over 2 drinks per week, which is a surprisingly low amount. So our objective here is to inform Canadians about the risks of alcohol consumption, and to the extent people are willing to cut down on their drinking, that would be wonderful for their health.
All right, so what exactly are these guidelines specifically calling for? What would these labels look like? What would they say?
Well, one of the things is we're trying to help people understand different risks of drinking based on how much they drink, so they can make informed choices about whether they might consider cutting back on their consumption. The problem is that in Canada, there's no way of knowing what a standard drink is to even assess one's level of risk. So what we're calling for, in addition to giving information and guidance to citizens, we're also calling for labels, mandatory labeling of alcohol products. So that would include things like defining in, let's say, a bottle of whiskey, how many standard drinks are in this bottle and what is the volume that constitutes a standard drink, as well as things like, warning labels, particularly for cancer. Alcohol is an important cancer-causing agent. None of that information, or even the calories in a drink, has more calories per gram than sugar. None of that information is found on the bottle, and I think we think that consumers have the right to have that information in an accessible way.
Now, these guidelines are quite a drastic shift from previous guidelines back in 2011. I believe it's a 15 drinks for men and 10 drinks for women a week. So tell us a little bit more about these new guidelines and the effects and risks associated with even small doses of alcohol.
Yeah, and again, a lot of that is because of the shifting science that the sort of the effects, particularly on cancer, and also actually the surprising effects of increase in heart problems, even at what we would have thought before were relatively low levels. We're not telling people to go for one number. We're defining risk zones. So for up to 2 drinks a week, which is a small amount of alcohol to be sure, that's the kind of the lowest risk zone for people who drink. And then 3 to 6 would be sort of a moderate one, and then it goes up beyond that. But again, our idea is not to tell people to get to a specific level, but to encourage folks to cut back from wherever they are. And even if somebody's drinking 6 or 7 drinks and they can cut down to 4 drinks per day, they're going to do themselves a world of good. So we don't want to just tell anyone, like in previous guidelines, this is the one number you got to try to get to, because we want to work with people where they are, but we also don't want to pull our punches scientifically. We want people to understand the risks and to be informed.
All right, just about a minute and a half left here, but I really want to jump to your particular research when it comes to this report. So we know you looked into alcohol attributable death and disability for this final report. What were your findings, doctor?
Well, again, what we find is that above 2 drinks per week, you have an increased risk of having an alcohol-caused death or a portion of your life removed. For each alcohol-caused death, it actually happens among, as we know, a lot of young and middle as well as older age adults. So this is not just like losing time at the end of one's life. So that's what we do. Without getting into too much gory detail, we look at the risks for each of the conditions that is known to be related to alcohol and kind of put together a composite risk curve for people, and that's how we arrive at our estimates.
All right, doctor, just a quick 30 seconds left here, but if there is one thing you want our viewers to take away from this conversation, what would it be?
Well, the one thing is that, again, when it comes to alcohol, it basically boils down to that less is more. Alcohol consumption is associated with longer and a better and healthier life.
Less is more. All right, Dr. Naim, thank you again
More.
for your time today.
Thanks so much for having me. Bye.
Stay with us. We'll be right back after the break, and we're going to be taking a look at the debate over public and private health care up next. Ontario's premier recently announced that the province would expand the delivery of public health services to private centres. We're going to be speaking with Miss Colleen Flood, research chair in health law and policy and professor at the University of Ottawa after the break, so stay tuned.